Good morning friends, welcome on my channel Charming Science. Today's lecture on the calcaneal bone, commonly known as the heel bone. This is an important topic especially for the medical and the physiotherapy student, as the calcaneus plays a crucial role in the weight bearing, movement and biomechanics of the foot. Throughout this lecture, we will explore its anatomy, functions, its articulations, its clinical significance, and much more things about the calcaneus. So, come and let's begin. So, the calcaneus is the largest tarsal bone in the foot and it is situated at the back of the foot, forming the prominence of the heel. It is essential for weight bearing and movement. When we talk about the definition of the calcaneus, we will say that the calcaneus is a short, irregular bone that forms the foundation of the rear part of the foot. It is positioned below the talus and behind the cuboid. Together with the talus, it forms a subtalar joint, which is responsible for important foot movements. When we talk about the function and the roles in the locomotions, we will say the calcaneus plays a critical role in various functions of the foot. Weight bearing function. It absorbs the body weight while standing and walking. The second function is the attachment signs for the Achilles tendon. So the posterior surface of the calcaneus provides the attachment to the Achilles tendon, which is crucial for walking, running and jumping. The third one, and not the last one, but the third one is the subtalar movement. So it helps in movement like inversion and eversion and allowing us to adapt a different surface while walking. When we talk about the anatomy of the calcaneus, we will see that the calcaneus is an irregular shaped bone and having a bone like cuboid like bone. This is an irregular shaped bone. It is the largest and the strongest bone present in our foot, and it acts like a shock absorber during walking, running and jumping. When we talk about the surfaces of the calcaneus, we will say that the calcaneus having the 6 surfaces, each with unique anatomical and functional feature. So there are the 6 faces are the superior surfaces, the inferior surfaces, anterior surfaces, posterior surfaces, medial surfaces and the lateral surfaces. So when we talk about the superior surfaces, we will say that the superior surfaces of the calcaneus is where it connects with the talus through 3 facets. Again I am repeating it. The superior surface of the calcaneus, this is the superior surface. So the superior surface of the calcaneus is where it connects with the talus through 3 facets. The 3 facets are the anterior facets, anterior talar facet, the medial talar facet and this one is the third facet, which is the posterior talar facet. And these facets play a critical role in the forming the subtalar joint, which allow side to side movements of the foot. Between these facets is a groove called the sulcus claneus groove or the calcaneal sulcus. This is present between the medial talar and the posterior talar, which form the sinus tarsi along with the talus. The sinus tarsi is contain important ligament for the foot stability. We will talk about this ligament in our further slides. So we have done the superior one. When after the superior one, we will come to see the posterior view. Here the downward, this is the another structure beneath the superior view, there is the posterior view. So the posterior surface is the largest part of the calcaneus and serve as the attachment site for the Achilles tendon. So in the posterior surfaces, there is having only the one major role is to provide attachment to the Achilles tendon, and it is the strongest tendon in our body. This tendon is essential for plantar flexion and help us while walking, run and jumping effectively. When we talk about the inferior surfaces of the calcaneal bone, so the inferior surface of the calcaneus is responsible for weight distribution. In the inferior surface, it is responsible for the weight distribution. The calcaneal tuberosity, particularly its medial and lateral processes, provide attachment for important muscles like the abductor hallucis and the abductor digitorum minimi, and which contribute the foot arch and foot movement. So in the inferior surfaces, it is responsible for the weight distribution and it's having the calcaneal tuberosity. In the medial surfaces, we will see at the inferior surfaces, we will see that it's having the calcaneal tuberosity, and the calcaneal tuberosity, it provide attachment to the abductor hallucis and the plantar aponeurosis. Abductor hallucis is the muscles and the plantar aponeurosis is the aponeurosis mean it's a sheet, fibrous sheet which is present beneath the plantar side of our foot. And the another one is the lateral process of the calcaneal tuberosity. So here is the lateral process of the calcaneal tuberosity which provide attachment to the abductor digitorum minimi, and along with that they both work biomechanically and contribute to make the foot arch and movement, and due to that these are the majorly responsible for weight distributions. Now when we look at the anterior surfaces, the anterior surface is relatively small but important because it articulates with the cuboid bone, forming the calcaneocuboid joint, and the joint along with the talonavicular joint make up the transverse tarsal joint, which is responsible for foot flexibility during walking and running. Now we come on the medial surfaces and we will look out the medial surfaces. This one is the medial surfaces image. So medial surfaces, on the medial surface of the calcaneus we will find an important structure called sustentaculum tali. This is a structure that is the sustentaculum tali. It is a bony projection that supports the talus. Okay, this act like a ledge with that support the talus and provide stability to the ankle joint. This is the structure of the sustentaculum tali, and it provides support the talus and provide stability to the ankle joint. Below this structure there is having the attachment for the flexor hallucis longus tendon passes from there. There you can see that below that structure there is having the line. Below that at this surfaces the flexor tendon of the flexor hallucis longus will pass from there, and it is responsible for flexing the big toe during activities like walking and running. In the lateral surfaces, that is the first one images. In the first one image, it is the lateral surface. We can see the lateral surface of the calcaneus feature a small bony prominence called the peroneal tubercle. Okay, so in this structure we will see that this is the structure of the peroneal tubercle. Peroneal tubercle. This tubercle acts as a pulley to guide the fibularis longus and brevis tendon. It acts as a pulley to guide the fibularis longus and brevis tendon, which are responsible for foot eversion. and these tendons helps prevent excessive inward rolling of the foot, reducing the risk of ankle sprain. Now we will see the articulation of the foot or the articulation of the calcaneus. So the calcaneus articulate with the two bone, forming the two important joints that are essential for foot movement and stability. So here is the calcaneus bone. Form the subtalar joint. It's from the subtalar joint. This is one is the upper one is the talus. It's from the subtalar joint and the calcaneocuboid joints. This is the cuboid bone. So it forms the joint with the calcaneocuboid. Now we will talk about the subtalar joint. So when we see that the subtalar joint, the talus is the bone that is situated above on the superior surface of the calcaneus. So the subtalar joint, or we can say the calcaneal joint, it's formed between the superior surface of the calcaneus, and it's having the three facets, that is the posterior. We have talked about it in our previous slides, that there is having the three facets, the posterior, medial and the anterior facet. So the talus will attach on the superior surface of the calcaneus. We go specifically on the posterior, middle and the anterior facet that is present on superior surface of the calcaneus. It is a plain synovial joint, and sometimes it also have to refer to a two compartments. There one is the posterior compartment and the anterior compartment. So it's a joint when it's formed the joint between the posterior, middle and the anterior facet. So the joint formed between the superior part of the calcaneus from the posterior facet to the talus, this one known as the posterior compartment. The another one is the anterior compartment, is the compartment in which the superior surface of the calcaneus make facet joint from the medial and the anterior facets from the talus. These are known as the anterior compartments. While forming the joints, it's having the ligament that's provide the interosseous talocancalian ligament, the cervical ligament, medial and lateral talocalcaneal ligaments. When we talk about some movements permitted, it helps in the inversion and eversion of the foot and do the slide, gliding and the rotations movement. Okay, so the subtalar joint is a vital for side to side movements. We can see the inversion or the eversion movements of the foot, and its structure allows to adjust our footing on uneven surfaces, and it is a key to balance and adaptability during walking and running. The second joint is the calcaneocuboid joint. So the calcaneocuboid joint is the joint which form between the anterior surface of the calcaneus and the posterior surface of the cuboid. So we can see this one is the calcaneus and this one is the cuboid. There is the anterior surface of the calcaneus and the posterior surface of the cuboids form the calcaneocuboidal joints. It is a saddle type of joint, saddle type synovial joint, and sometimes it's also described as the modified ball and socket joint. It's not a complete ball and socket joint, but sometimes it's called as the modified ball and socket joints. It's the parts of transverse tarsal. There is having the line which says that it's a parts of the transverse tarsal or the Coppart's joint. Along with the talonavicular joint, it contributes to the flexibility of the midfoot. The ligaments involved in the long plantar ligament that extend from the calcaneus to the metatarsal bases, and the short plantar ligament that is the calcaneocuboid ligament. There is another one more important ligament is the bifurcate ligament, and it from calcaneus to cuboid and to navicular. The movements done on the calcaneocuboidal joints are the rotations, inversions and the eversion and slightly gliding movements, which help in the pronation and supinations of the foot. So the calcaneus cuboidal joint allows flexibility and slight twisting motions of the foot, and this joint helps the foot act as a rigid lever during push off in walking and as a flexible structure for adapting to terrain. So this is the summary of the articulation. So the calcaneus form the two key joints, one with the talus and another with the cuboid joints. The subtalar joints help us in shift and weight and maintain balance on irregular surfaces through inversion and inversion, while the calcaneocuboidal joints add flexibility and stability to the midfoot during motion. The talus and the subtalar joint is known as the plain synovial joints, and with the calcaneocuboidal joint is known as the saddle synovial joints. The talus one work with the movements inversion and eversion, and calcaneocuboidal joint will help in the movement of the rotation, inversion and the pronations. Now we will see the muscles attachments on the calcaneus. So we start from the posterior surfaces. We have seen that the posterior surface is majorly responsible for the attachment for the Achilles tendon. The Achilles tendon is formed from the gastrocnemius, soleus and the plantaris muscles, and they insert into the middle rough portion of the posterior surfaces. So this is the structure of the posterior surfaces where the Achilles tendon will go to insert or the going to attach, and it helps in the plantar flexion of the ankle. When we talk about the inferior surfaces, in this image we can't see the inferior surface of the plantar side. So in the inferior surfaces we having the middle tubercular of the calcaneal tuberosity. We have seen this in our previous slide that the inferior surfaces we having the structure that the medial tubercle of the calcaneal tuberosity, and below that there is having the place from where the abductor hallucis and the flexor digitorum muscles will go and attach from that, and this help in the plant. This is the plant part of the plantar aponeurosis. There is having the another landmark is the lateral tubercle, which provide the attachment to the abductor distal minimi, and there is having the another anterior tubercle, which is the partial attachment for the long plantar ligament, and these are indirectly associated with the muscle tendons and the fibularis longus. In the lateral surfaces of the calcaneus, we have seen the around the peroneal tubercle, peroneus brevis tendon passes from the above, and the peroneus longus tendon passes from the below. These muscles do not insert on the tubercle, but they just guide them or provide the place to go straight. On the medial surfaces there is having the structure of the sustentaculum tali, and it's provide the groove for the flexor hallucis longus tendon that is passes under the self, and again it's not an insertion point but it's an important site for function it properly. On the anterior surfaces, no major muscles attachment on the anterior surface. The surface articulate with the cuboid bones. So in summarize, the calcaneus act like an anchor back block of the foot, and the muscle that attach to it help us walk, run, balance and maintain the shape of our foot. The Achilles tendon is especially important, allowing us to push off the ground, while intrinsic muscles or the plantar muscles control the arcs supported. So now we talk about the ossifications of the calcaneus bone. The calcaneus is the first tarsal bone to begin ossifications. So along with all the tarsals, it is the first tarsal bone to begin ossification, and it's having the one primary centers, one secondary centers, and the process is important to understand, especially in pediatric cases, orthopedic, as an abnormality, and it can lead to a disorder like Sever's disease. So the primary ossification center, we can see here is the structure of the first primary ossification centers, and these are the stages of the primary ossification centers. Okay, so the primary ossification center is the appear in the 4th to 6th month of the intrauterine life, and location, it is the center of the calcanean bone or the body of the calcanean, where the body of the calcanean will be there. It is in the center of it, and it forms the main bulk of the bone. In the secondary ossification center, it appear around 6 to 8 years of age, and in this the posterior end of the Achilles, posterior end of the calcaneus, or the site of Achilles tendons attachments. It fuses with the main bone around 14 to the 16 years of the age. Now we will see the clinical anatomy of the calcaneus, but before that we will summarize the ossifications. So the calcaneus begin ossification in fetal life even before birth, and making it the earliest tarsal bone to ossify. Later in childhood, an apophyseal center appears at the back or the posterior sides of the calcaneus bone, and the site where the Achilles tendons pulls. In many growing children, the site become inflamed and leading to a condition called Sever's disease, especially among sports players. Now we will talk about the clinical anatomy of the calcaneus. So the calcaneus is prone to various clinical conditions, especially due to its role in the weight bearing and shock absorption. Understanding its clinical relevance helps correlate anatomical knowledge with diagnostic and treatment approaches. Okay, so the calcaneus fracture, it is the most common fracture that occur whenever a person or the children will fall from a height and landing on the foot. It's a high energy trauma. So the calcaneal get fracture in there. It can be the intra-articular fracture or it can be the extra-articular fracture. So in the intra-articular fracture, it involves the subtalar joints, and it is a more common of them, and the extra-articular fracture in which that does not involve joint surfaces. So the main difference between the intra-articular and the extra-articular is, so the intra-articular fracture is the fracture in which the articular surfaces will involve, and in the extra-articular fractures in which the articular surfaces are not involved in that. So whenever they having the calcaneal fracture, it's having the heel pain, swelling, and inability to bear weight, and it's often associated with the spinal compression fractures due to axial load. So why we are saying that it is often associated with the compression fractures on the axial loads? Because whenever you are jumping or falling from the height, the first contact surfaces, which the part which come in the contact surfaces first, it is the calcaneal bone. So it gets the force impact or the high impact energy or the high forces on that, and according to the biomechanics, when the energy is absorbed by the calcaneus, the energy biomechanically is sent to the our spine or the trunk, which is the mainly responsible for the axial loads. When we talk about the diagnosis, the CT is often required to assess complex fracture involving the joint surfaces. So if it's an extra-articular fracture, it will be easy in the X-ray, but if it's an intra-articular fracture, then we will go for the CT scans. The second one is the Sever's disease, or it is also known as the calcaneal apophysitis. So in the Sever's disease, it's a structure. We can see this is a structure, and the age is 8 to 14 years. What does it mean? The 8 to 14 year is the age from which the secondary center or the ossification center will appear, that is from the 6 to 8 year, and the Sever's disease also start from the 8 to 14th year. So due to the traction at the secondary ossification center, from the Achilles tendon. It's mean so it's a severe disease. It's a condition when the secondary centers all the secondary centers is start from the 8 to 14th year, start appearing from 6 to 8 years, and they join later in the life till the 14th or 12th year. So when the secondary centers it's appear and it's forming the joint or making a complete joint with the calcaneus, so at that time if the pull due to the any activity, due to the jumping, playing, or by any, if the Achilles tendon will pull the secondary ossification center, it will cause the friction between the misalignment from the calcaneus bone, and along with that it cause the severe disease at present as the feature of the posterior heel pain, and it worsen with the activity. The third one is the plantar heel pain or the plantar fasciitis. It is the site of pain is the medial tubercular. The exact point is the anteromedial tubercular of the calcaneus, and it's having the origin of the plantar fascia. So when we see that it's the part in which there's a in the anteromedial surfaces there is having a pain. The exact point will be the anteromedial surfaces, because this is the only places where the plantar fascia will going to be originate. It can cause due to the overuse, obesity, and due to the poor footwears. Pain is often worse with the first few steps in the morning, and it is a classical sign of the plantar fasciitis. There is another condition, that is the heel spur. So heel spur is a bony outgrowth from the calcaneal tuberosity, usually from the medial side, and may be associated with the plantar fasciitis. It can also associate with the plantar fasciitis, but it can generally seen in the later or that after the 3rd decades of the age. There is one of the major one is the tarsal tunnel syndrome. So the tarsal tunnel syndrome is a neurological condition in which the compression of tibial nerve. So the tibial nerve will passes from the calcaneus side. So the compression of the tibial nerve near the medial side of the calcaneus under the flexor reticulum, and due to this it causes the tingling and numbness in the sole of the foot. So the clinically the calcaneus is significant because it's commonly injured in falls, heel pain, and also arise due to repetitive stress or overuse, as seen in the plantar fasciitis severe disease. And knowing the anatomy helps localize and treat the problem effectively. So in the summary, we will have seen that the calcaneus is the largest tarsal bone forming the heel of the foot. It's having the 6 surfaces, each with distinct landmarks and the clinical relevance. It's provide attachment for the key muscles like the Achilles tendon and intrinsic foot muscles. It articulates with the talus forming the subtalar joints and the cuboid forming the calcaneal cuboidal joints. It ossifies early. Primary center appear in the fetal life, and secondary center appears around the 6 to 8 years of age. It's having the clinical importance in fractures, severe disease, plantar fasciitis, heel spur, and the tarsal tunnel syndromes. So the calcaneus is not only the foundation of our heel, but also a key anatomical structure involved in balance, movement, and shock absorption. Knowing its landmark, ossifications, and clinical implications is essential for both diagnostic and rehabilitations. So that's all for the calcaneus bone. I hope you learned the best. If you like our lectures, so please like, subscribe, and share our channel, that is Charming Science. Thank you very much.